I am Shayna Melissa Stockman, the host. I've been a registered nurse now over 30 years, a nurse practitioner and the world wellness expert. Basically, when your healthcare providers won't get you healthy and feeling better, I will, often without the drugs, either live in person or on a video visit. Today, we have a really cool topic. We're going to talk all about legalities and how patient care, compliance, and regulations, doing things within the law. If you are a nurse, another fellow healthcare pro, or a business owner owns a healthcare facility, you're going to want to stay tuned for this. We have a very, very special guest that I'd like to introduce to you. She is a fellow nurse who then became an attorney. She specializes in compliance, patient care, and regulatory. She is known as a Miss Irnise F Williams, is a healthcare and regulatory compliance lawyer who, although we're in different states, she has clients in several states on video visits like this. We've also both spoken for the Nurse Practitioner Association. She's actually been their keynote speaker, which is really cool. Kudos to you. I believe she graduated from Howard University, correct?
Yeah.
And Miss Irnice F Williams, thank you for being here today. I know your schedule has been super slammed and this is evening time for you. So thank you.
Yeah, no problem. You know, when you're preparing for vacation, it seems like it's just never ending stuff to be done, but all good. We're here. So excited to be here and kind of jump into this conversation.
Awesome. And it's so cool that you're a fellow nurse like me. So
Yeah.
as an attorney who counsels nurses and other healthcare pros, you truly know all the the linguistics, the medical documentation that's involved, as well as the regulatory rules, regulations, compliances, patient care aspect. So that's really cool. So we're not just going to an attorney. We've been going to someone who's on our side that really knows the ins and outs. So that's really cool. Now, I have a question for you. What now? Oh, also, we both, in the height of this pandemic, worked the front lines in New York, which is another parallel we have. So thank you for your service.
Yeah.
People only thank servicemen in like the military, but they don't realize we were truly risking our lives on the front line with no protective.
The unknown. Yeah, it was such a scary, crazy time. It doesn't even feel like it was real.
Yes. Now, thank you for that. And what made you go from nursing to law, to the other side?
Yeah, I don't think the law is the other side. I think it's
well, yeah, okay, take that back.
Right? Like it's heavily integrated in everything that we do. And I think the issue is that healthcare is heavily regulated by people who aren't in healthcare. And so there's a lot of rules and policies that come down and we're like, well, why would someone say that that doesn't even make sense, or that is impossible for us to actually comply with. So I think for us, when we have someone who is a nurse in politics, who is a nurse in the law, who is a nurse in finance or banking, it's like we're able to tie some of the areas of the work that we do to the real world, right? I think healthcare is kind of like this world that's kind of fake, right? When you're in a healthcare system, it's idealistic. We're trying to say, yes, if you take these medications, you're going to get better. Many times people take those medications, as you know, and they don't get better. Say, if you do these specific things, you know, you're going to prevent, you know, certain things from happening. And people can be, you know, lean and exercise every day and still have a heart attack, right? So we create, healthcare is creating these scenarios of perfect ideal situations, but really not able to control the outcomes. And it's because we're not connecting to people's holistic health, where we're dealing with all of the things that are kind of impacting them: housing, the criminal justice system, food access, you know, community access, safe communities, things like that. And so that's kind of what interested me in the law. I didn't want to go through healthcare for the rest of my life, not being able to understand why these decisions were being made, who was making these decisions, and how we could kind of change some of the decisions that were being made that would impact us.
I love that you take a holistic approach, because that's how I do it. And people don't realize a lot of the health insurance carriers, their rules and regulations are not made by medical people. They're made by managerial corporate CEOs that have no idea the reality and the Oh my God, don't get me started on that.
Yeah.
But it's so true. I remember back in the day, I was trying to get like a nuclear stress test approved. And the rules that they had, I'm like, listen, this guy's heavy, diabetic, high blood pressure. His dad died of a massive heart attack at the same age, and you won't approve this screening test for him.
Mhm.
How much, and he has high cholesterol. How much more do I need? And who is making this rule?
Yeah.
Like,
Yeah.
if he doesn't need this nuclear stress test, who does? And it
Mhm.
turns out I fought the insurance tooth and nail, and eventually he had it, and he went to stress test. He ended up with like quadruple bypass.
Of course. Right. It's like you as the clinician, you as the provider know. You see the patient. They've never seen a photo of the patient. They don't even know what the patient looks like. All they see are numbers or words on a paper, and they're making these big decisions. And so I think healthcare has done a really great job of staying in their lane, which is not good when you're trying to create change. You have to
Yes.
be disruptive. You have to explore new areas.
Yes.
You have to get out of your own world, out of your own clinics, out of your hospital systems, and get into the places where the decisions are being made, so that you can actually have an impact on the outcomes versus just the intent that we are experiencing. So
Yes. And I think sometimes with these rules, it's just a numbers game to them. If they're
mhm.
like, listen, we would have caught one heart attack for every 100 tests we order, then financially the ROI, the return on investment, is not there. And I'm like, but that's one life that we are saving. It's worth doing 99 other tests that
Mhm.
might miss, you know?
Yeah.
And I've been advocating for women for mammos before age 40. Thank God
Yeah.
now we're starting to do that.
Yep. Such a hard, so many people will feel a lump who are in their 30s. My friend actually just passed away from breast cancer last week. And she found out she had breast cancer when she was 30, 33. And, it was started with a lump, and it was like, struggling, trying to get someone to say, yes, you need a mammogram, because she had no history. Nobody in her family ever had breast cancer. Like, this was just such, she wasn't on birth control, like all of these different things. And come to find out she had something that was extremely aggressive. And so I think the conversations that we're having have real life impact, right? That one person who you say no to the mammo could essentially been saved or had a
Yes.
better outcome or a better experience if they received access. And so, I mean, I saw that a lot in the work that I did, and, everywhere that I worked, whether it was the OR, pre-op PACU, in the community, I just saw people who weren't invested in preventative care, and their answer was always
Yes.
cost. It was like, my insurance won't pay for me to come back for a second visit. I lost my insurance, or my medication is too expensive, or just all of the things, or the insurance company denied the medication that they really needed, and they're
Yes.
making them enforce them then to take something else. And all of those decisions are regulated by Congress, right? So insurance companies are authorized to do these things on a congressional level. If those rules change, then if the regulations change, then the insurance companies have to change. But because they have so much money, right, they are the ones who are winning over Congress, convincing them with all of these studies and experts who are saying, not needed, nobody needs this, while Congress has 100% coverage, can go anywhere they like to get care, will be rushed to Walter Reed if anything ever happens to them, which gives them, quality outcomes. And I think that's something that's really missing in some of our communities.
Yes, I'm so glad you brought up the holistic approach, because yes, there's certain people that can't afford to eat healthier, so they're more likely to be overweight, have diabetes, have cholesterol, have high heart attacks. And the regulations really need to change, because I'm sick and fighting for my patients all the time with advocacy. It's insane, and my attitude is this: if your healthcare provider is not getting you healthy, you need a second opinion, a third opinion, a fourth opinion. Reach out to me, because I fired doctors before. They're not the only ones that get to fire people. We get to fire them. It's like, if your contractor is not doing a good job, get another opinion, right? Fire them. So we can have the power. And another thing is, so thank you for bringing up the holistic approach. That's very important to me. And knowing the laws and the regulations. And sometimes they're just so far behind, right? By the time the laws get approved, and if they do, it's like insane. And sometimes when people say they can't afford it, I remember back in the day, we used to fight for patients to get the drug that would help them quit smoking, right? But the insurance carrier, you know what I'm talking about? The insurance carrier did not want to pay for that medication to help them stop. But if they got lung cancer or COPD, that was going to cost them so much more money. So I don't know who made up that rule that they can have the same drug for depression, but if they needed it to quit smoking, they couldn't.
Yeah.
And you know, sometimes sometimes the patient says they can't afford it, but I remember sometimes patients saying, well, how much is that drug for me to quit smoking? And I'm like, well, wait, how much are those cigarettes costing you that you can afford? So sometimes the patients need to redirect spending, you know.
And I think it's a mindset thing, right? I think when we tell patients, if you eat, like, you may not have to eat healthy every meal, but like if you start your day with a healthy breakfast and change that out, that could really impact your health. But I think sometimes when we give people options, it's like, you know, black and white, do or die, this or that, instead of really trying to integrate into people what people's current lifestyle is, right? Like a lot of patients that I used to engage with were like, okay, I don't have access to a refrigerator, or, you know, I'm a postal worker, so of course I'm going to eat out, you know, every single day because I don't have anywhere to store my food, or I don't have an office, right? We kind of, again, create these fake ideal scenarios of why people should do certain things, but not really understanding what is triggering or what other kind of things are impacting people's decisions, right? Most people are going to spend money on cigarettes over the medication. It's because they're stressed. Why are people overeating? Why are people smoking? It's because it's a relief for them. And so we can't replace that relief. And the only option we can give them is something that we feel like they need, but they don't necessarily feel like they need. I think that's when things really, really change. And so, you know, I think it's a hard conversation to have on both sides, where you're trying to get the regulators to change, you're trying to get the patients to change, and you're in the middle trying to put all the pieces together and make it work so that you as a provider can make sure that your patients have good outcomes.
They have to be ready too. And sometimes, you know, once I educate them, then they're like, wow, because sometimes, like, I had a patient that was over 300 pounds, came in new to me with a cough, and I take his blood pressure. It's high. Oh, it runs in the family, he says. Oh, he was fasting. I was like, let me check your sugars. His diabetes ran in the family. It's high. But once I empowered him to realize it's not just his family genetics, it's the way mom taught him to eat and the sedentary lifestyle that led to the weight, and that caused the diabetes and hypertension. I helped him drop over 100 pounds. His diabetes went away, his hypertension went away, his knee pain was better. So sometimes we just need to empower them with the knowledge. They don't realize, they might just think it runs in the family too.
Yeah, but that takes time, right? That most providers don't have.
It's an uphill battle sometimes. And so thank you for enlightening us on a holistic approach, and they need education as well. And we have to work with where they're at. Sometimes they're just not ready, you know. Sometimes they're never ready. And sometimes we can give them choices. I don't say, don't do this. I say, hey, instead of this, why don't you do this? You know, like, let's start cutting back. How many you smoke a day? 20 cigarettes, maybe, you know, within a couple of weeks, you can be down to 18, you know, or something.
Crazy.
And I try to give them.
How do you have time to smoke that many cigarettes?
Oh God, yes. Sometimes I help them because I figure out how much they would spend in a year. And I'm like, if you had this extra $20,000, say, what would you do with that? Where would you go? So sometimes positive reinforcement helps. And then, so you went from nursing to law, and now you're helping a lot of nurses, healthcare pros, and business owners that own healthcare facilities. And can you share with us a couple of pro tips that maybe we can take away?
Yeah, I mean, I think when it comes to healthcare businesses and trying to stay in compliance, it's the goal is effort and not perfection, right? I think some people think if I do these 5 things, I'm in compliance, and compliance is an always evolving process, and some things you will know about because it's in the news, or you receive a notification, or the board sends out something, or the association that you're a part of has a presentation on updates or things that are happening, or sometimes you don't know. And I think, you know, there's this big bad wolf thing that people think is like someone sitting there waiting for you to make a mistake so that they can take your business from you, or hit you with a penalty, or hit you with a fine. And the truth is, many of these agencies are so small, and they're trying to control hundreds, thousands of businesses in the community. And that's not really the case, right? So I think there's a really hard thing where people feel like, so many people are doing it wrong. What's wrong if I do it wrong as well, right? Like if everyone's doing it wrong and I'm just one of them, why do I get held responsible? Or why should I worry about being held responsible when nobody else is worried about being held responsible? And then there's, this burden of like, it costs so much or it takes so much to be in compliance. So then again, why would I spend my time, money, and effort on doing that, knowing that they may never come after me? And so what I tell people, right, is that compliance is also an internal thing as well as an external, thing for your business, where your clients should be able to trust you because they know that you're protecting their data. They know that you're HIPAA compliant.
Yes.
They know that you're doing things the right way, that your refrigerator, is at the right temperature and you're storing the medications appropriately and you're double check. Like, it's a trust thing, because once you have a violation from any agency, whether it's Department of Health, whether it's the board, whether it's a patient complaint or someone who's left a bad review, that breaks trust, and it takes so much more effort to rebuild it. So doing things the right way the first time is a preventative thing for you as a business owner. And it's an ever evolving process, and some things you can do and be done with, you can say, okay, I'm HIPAA compliant or I'm OSHA compliant, and then I can follow back up in a year. And there's some things that you have to continuously focus on in your business to make sure that it's being done right every single time. Specifically billing, right? If you're billing for your services, you have to double check sometimes and do audits on your own billers to make sure they're doing things right and they're not illegally billing services that you haven't completed, or essentially, not billing services that you have completed. And so there's this checks and balances that comes with being in business that may be difficult for people who are nurses or nurse practitioners or other healthcare providers who are coming from an employee to now either being an entrepreneur or an employer, where you're responsible for other people. And I think that's something that's a hard thing to grasp when you're new to business.
And that's a very valid point that you brought up about the billers, because sometimes the billers get incentivized when they bring in more money. So they want to bring in you more money. So if you did a level 3 visit, they might want to bill it as a 4. They might be like, oh, that simple shot. Yeah. And hype it up a little bit. So that's a good point to bring up. You got to check your billers, because ultimately it's our licenses and our liability. And if I lose, say, my privileges for Medicare and Medicaid for overbilling, then I'm going to lose all the other insurance carriers.
Yeah. Yep, definitely.
And then they're going to ask for money back too.
And they want that money, and they're going to hit you with a penalty every single time. So it's not worth, and I think it's just hard, because when you're in a role of being a clinician and that's your passion and what you love to do, that's going to come easy and you're going to, gravitate towards that. But the business still has to be ran. You still have to focus on the back end, or you have to hire someone who you are working with to focus on the back end, because you can't just allow that to kind of flounder on its own. So that's really kind of what I try to help people do, is build the system so that when you're building the business as it grows, you already have those checks and balances in place, so that you're saying, okay, every month I'm running this report to see what was billed, or I'm running a report to see how many patients I saw. And I'm making sure that all of these things are in order, so that as I grow, I'm not caught 5 years from now for something that happened, 5 years before. And now I have to go back and pay $100,000 because I messed up. So.
And I know the insurance carriers now are actually sending letters to the patients saying, hey, did you go to this specialist on this date, or did you get this test? So they're like double checking us. And I worry sometimes the patient might forget they had a test or a visit and then tell the insurance no, and you might be audited for no reason. I mean, knock on wood, I've never had a suit or a claim or anything ever. I don't want to brag yet. It's only been 37 years, but you never know. And I know like my documentation is so thorough, like almost everybody was probably a level 4, but I didn't want to bill all level 4s and be flagged. So sometimes I bill like a 3 and, it's important documentation, right? Even though you spend like 40 minutes in a room with a patient, if you didn't document that level 4 and you're billing for it, they're going to come after you and ask that money back. And I've worked for doctors where they just randomly get audited. Hey, let's see your files. Let's see the patient charts.
They take 100 patients and then they say 40% failed, and they apply that to your entire practice. So if you have 4,000 patients, they will say 40% of your patients were essentially non-compliant, and that's how your fees are assessed.
Wait. Can you say that one more time?
So when they audit, they come in and take 100 or 1,000 patients, and based on that audit, that's the percentage of people who they consider in your practice. Like if out of that 100 or out of that 1,000 for some of the bigger organizations, they'll say out of that 100, you only 60% were compliant. So that means 40% were non-compliant. So we're going to apply 40% towards your entire practice, and that's how the penalty is assessed.
And then for how long back do they go? If they
It
say,
depends
hey,
how long they were doing the audit for whatever years they were auditing.
Wow. So they could say, hey, for the past 3 years, we want 40% back or whatever.
Yep.
Whoa, that's crazy. I know in the past when I've worked for doctors, they've had random audits come and they're there all day looking through patient charts. Thank God, like I probably over document if there's such a thing. I don't know. Yeah. Well, that's awesome. And now see, there's people that want to reach out to you. I know you're in a different state than me, but you have clients in different states as well. And you do virtual visits, kind of like this, but private, confidential. Yeah. That now I guess you would talk to either if they have a compliance staff, or you would come and educate them of their staff, or counsel with them and see what their deficits are and where they.
So yeah, sometimes people reach out and they work with lawyers or run into situations and they can't find the answers. And so they'll book a consultation with me, kind of map out some of their challenges and figure out some of the things they need to get done. And then we point them in the right direction. So if there is a specific lawyer that they may need to work with, now that we've identified their issue, they can take that issue to the lawyer and say, this is my issue. Because sometimes when you go to a lawyer and you say, I need help, they're going to help you, but that's going to come with a bill for every time you have a question, everything, figuring out the process cost. But when you know what your issue is and you have a clear assessment of that, it's easier for them to get that resolved. But I've partnered with a couple of different law firms in Texas and New York and North Carolina. I'm licensed in Maryland. And then I partner with a firm here in Georgia as well, because that's where a lot of my clients are coming from, where people are asking the same questions over and over and over. And so I've kind of built in those partnerships to partner with those law firms so that we are able to serve those clients and give them the tools and resources that they need. And then on top of that, some people have been in business for a while and they're really not sure what they're doing. So we do business audits where we go a little bit deeper into the business, talk about the finances, the marketing, all of the real like business development stuff outside of the regulatory things, to help people understand, like, to make sure that they're actually building a sustainable and profitable business. Because money coming in and money going out doesn't mean that you're building a profitable business. It just means that the business is running, but actually being able to see what is left over at the end of the month and at the end of the year is what the business should be focused on, is profitability, which most people, again, aren't aware of because that's not in there, that's not something that they're familiar with. So that was
never taught in nursing school. I'm sorry, we didn't go into ROI, return on investment, profitability, because we don't take into account the hundreds of thousands we spent in our education and our licenses and our DEA and our insurances and our overhead and our programs that we need and the billers and the attorneys to go after the insurance carriers that don't pay us. Like, people don't realize that all adds up. If they do a little video visit with me, they're like, wait, how much for how long? And I'm like, all these programs, even just to send a prescription.
Just all of the programs you need to access, and everybody has a subscription now, and everything is like, and they don't even want to get paid monthly anymore. They want their money up front. And so it's hard, right? To run, like, operating a business and the operational cost that goes into a business is more than we ever even imagine. Like the accounting, the taxes, all of the things that we have to think about and consider eats into your profitability. And if you are not making a profit, the business will eventually die because it's just not going to be worth running, even if you're passionate about the work that you do.
And that's important, because I think in the past I was undercharging because I wasn't taking that into account. I'm like, I have 4 nursing licenses, my board certification, just the classes I have to keep doing to keep up on my board certification. And then you got the American Heart CPR, you got the insurance, you got the programs, the licenses, the programs to send the prescription, the program for the patient records, the HIPAA compliant programs, the video
now
programs.
Telehealth, right? Now telehealth program.
Oh my God. And
it's
they
a lot.
soak. And then you got the billers and then people don't understand, well, you have to pay an attorney to go after the insurance carriers for the monies that they owe. And then we get it like 2 years later and settle for like 80% of what was billed. It's insane. And then, so people can reach out to you, and you can also do like a virtual visit like this, or if they're local, you can maybe come to their facility, go check it out, talk to their staff, do like
so we do some staff training depending kind of on, again, most organizations, handle their training internally. But I'd love to partner with organizations that are really trying to elevate their staff to become thorough in their documentation, to become better in their communication, to focus on change management processes, to essentially have better outcomes, right? So focusing on how do you identify what's missing in each visit so that you're not missing these things and you can bill appropriately, or you can just have better outcomes for your patients, or you can integrate all the services that you offer in a way that makes sense and reflects the business model that they have. So.
Oh, that's awesome. And we don't want to keep them too much longer. Is there any final words? I don't know what we possibly left out. I'm sure there's something.
I think, nurses and nurse practitioners and other healthcare providers, getting into business is important because it helps you control your time. It helps you serve your community, and it helps you just feel more fulfilled instead of being on someone else's agenda. It's hard work, and it sometimes takes some time before it pays off. But if you build it and you build it right, it definitely pays off in so many different ways. And I think it helps us get back to the ways in why we became healthcare providers in the first place, right? Most of us did it for the work that we want to do and not for the things sometimes that we're forced to do. And so if you build a business on a strong foundation, you understand the business elements of the work that you're doing and not just the clinical, you can definitely be successful. So.
Oh, that's awesome. Now, thank you for that. And another question, what would you say to the nurse that's like, man, I'm getting burnt out here. Do I stay? Do I go? How did Irnise take that leap of faith and decide? Because like I kind of left traditional nursing as well, but I felt like I was made to create a deeper impact, and I wanted to really help people get better, not keep them sick. So, busting that move was scary after being in the field for 30 years and all our degrees and all our experience there. And what would you say to a nurse that's like, man, I love nursing, but I'm kind of getting burnt out, and I might want to explore a different area where I could still use either my skills and my knowledge, or maybe do something totally different. I don't know. What would you say?
I think you just come up with a plan. I think everybody's not up for a big leap, and it may look from the outside that someone took a big leap, but it took me 7 years to be full-time entrepreneur in my business. It wasn't overnight. It didn't happen in one day, in 1 year. So it sounds like, oh, it took me months to get into law school, right? I had to take the LSAT. I had to apply. I had to wait till, I received my acceptance, like that. Everything is a process. And so this idea that I'm burnt out in this moment and the solution is to do something else is going to leave you with your back up against the wall and burnt out in another situation because you weren't able to actually make a decision on what you wanted to do, instead of you're doing it because you feel like you have to do it. And so I tell people to create a plan, right? If you are exploring other things, taking courses, taking classes, watching people on YouTube, learning more things about what's out there, test out the waters before you give up, what it is that you're used to, and then see if that's better. Because sometimes you get out there and you're like, this is better. Let me stay where I'm at. And I can actually use my PTO or switch shifts. Okay, I loved working in hospice and, working in the community, but the traffic and, the wear and tear on my car, having to use the bathroom and like random places, like you don't think about those things on top of the work that's going into people's houses and they have fleas or mice or rashes, you know what I mean? Like, and so it's like you have to decide what you're willing to put up with. Do you want to put up with your manager, or do you want to put up with someone's dogs, in their yard, or being a little bit nervous about going into a space that's not your comfort zone, going into someone's home that you're unfamiliar with. So I think people just need to test it out. So I tell people, leverage your PTO, take your time off, get FMLA if you need it, like do whatever you need to do to take care of yourself, but don't jump from one frying pan to the next because you are uncomfortable where you are.
Yes, that's very good advice, because the grass is not always greener.
It
And
isn't.
we think so much alike. I was also a hospice nurse as well.
Mhm.
And I remember going into people's houses with like cockroaches, and when I was doing like peritoneal dialysis, and everything's supposed to be like sterile and clean, and I see like cockroaches, and I'm trying to talk to them and they speak another language than me. So the grass isn't always greener on those side. I always tell them too, before you quit your job, like test the waters elsewhere. So that's good advice, either vacation, PTO, or FMLA. I can maybe help them with that for and then also the baby steps is important, because it might not just be a leap. Like you had to start taking classes, law classes on the side, and passing the LSATs maybe while you were still going to nursing school. So sometimes those little baby steps help. And like when I tell clients, like, listen, if you just did 10 sit-ups a day in a year, that's 3,600 or whatever, 50 or something. Those little baby steps really add up. So it's not overwhelmed, but follow your passion too. Sometimes we can use, like you were able to use all your nursing experience and knowledge in switching your career from nursing to something else that's still able to, you're able to use all of that information.
Yeah.
So that's awesome. So I thank you very much. And if they want to go up to your website and check you out more, would that be the IrniceWilliams.com?
Yeah, you can find me at IrniceWilliams.com or your nurse lawyer on all social media platforms. Tons of content, conversations that are happening every single day. So don't hesitate to reach out.
Oh, that's awesome. Thank you. Thank you. Thank you. I know in your busy schedule for being here. Thank you for your pro tips, your words of wisdom. We're going to have in the future, I'm going to have my inner circle people have experts like yourself that have power hour workshops. So a different expert each time will have host a power hour workshop where we're going to get live Q&A. Give me 1 second. I'm just going to see if there's any other additional questions that we did not answer. In the meantime, I have some upcoming events. I have not only online classes, courses, and workshops. I have one on burnout prevention and recovery. I have another one on biohacking basics, one about food pharmacy. I'm just checking comments right now. And then also, give me 1 second here. There's a lot of people that have autoimmune problems and don't know it. This is one of my biggest passions because I suffered as well. Autoimmune, if you're tired and aching, you don't know why, and you're sleeping enough and you're still exhausted, or you're aching, you don't know why, your head's falling out, or you have these weird rashes and these symptoms that don't make sense, and your healthcare provider is blowing you off. A lot of times it's an autoimmune problem that's not diagnosed, more so since the pandemic. If they had the protection or the infection, they're coming out. That's my passion. Sorry, I'm just checking one more spot for comments. So my newest course that's ready to launch is going to be Get Healthy and Happy with Your Autoimmune Disorder. And then also I have live in-person coming up, where my live in-person events I love because I get to tell all, spill the beans. There's no filters, censorship, anything. I explain it all. I'm going to have a talk about autoimmune disorders and biohacking basics on Long Island, New York, in a couple of weeks. And then, so if you guys want to, you can't keep up because I'm just so crazy busy all the time. If you just want to get those exclusive invite special savings, and I have a daily dose of positivity that they get every day, they just go to ShaynaMelissa.com and submit their email on the pop-up. I don't give it to anybody else. They can unsubscribe at any time. So that would be my call to action. If you want to catch my live in person on Long Island in a couple of weeks, then go to the website and purchase your ticket now, because it's limited seats. They're definitely going to sell out. It's at a wellness center. So that's all I got to say is I want to thank you, Irnice, for being here. Reach out to her at IrniceWilliams.com on all her social media platforms. Thank you guys for staying tuned. If you didn't click the subscribe button, please do. If you want to check out exclusive invites, daily dose of positivity, upcoming event special savings, then just go to ShaynaMelissa.com, click that contact tab, and you can subscribe to the YouTube, follow me everywhere, submit your email on the pop-up, and you'll get my infrequent newsletter. So, oh, and also at my live event, they're going to have, I'm going to have some of my #1 international best-selling books. They're called Overcoming Life Obstacles, that they can, get it personalized for, treasured loved one or something. So I thank you guys for being here. Thank you, Irnice, again. And I like to say, be well, biohack, and OLO. OLO is the acronym I've created for you overcome life obstacle, like the title of my book, and then you optimistically lift others. It's a double acronym. OLO.